Hello everyone, I am Vasudha Chauhan and my topic is nasal decongestants, which comes under adrenergic transmission. So, what are adrenergic drugs? These are drugs with action similar to that of adrenaline or that of sympathetic stimulation. They can be divided into direct sympathomimetics, indirect sympathomimetics, and mixed action sympathomimetics. Now, what are direct sympathomimetics? These are drugs which act directly as agonists or alpha or beta or both alpha and beta adrenoceptors. For example, adrenaline, noradrenaline, isoprenaline, xylometazoline, methaxamine. Now, what are indirect sympathomimetics? These drugs acts on adrenergic neuron to release noradrenaline, which then acts on the adrenoceptors. For example, tyramine, amphetamine. The third category is mixed action sympathomimetics. These are drugs which act directly as well as indirectly. For example, ephedrine and mefentermine. This is the classification table of adrenergic drugs, which consists of pressor agents, cardiac stimulants, bronchodilators, CNS stimulants, uterine relaxants, anorectics, and our main topic, nasal decongestants. So, drugs under nasal decongestants are xylometazoline, oxymetazoline, nafazoline, phenylephrine, pseudoephedrine. These are some commonly used drugs as nasal decongestants in market: dimazine and otrivin. So, what are nasal decongestants? These are alpha agonists which on topical application as dilute solution 0.5 to 0.1% produce vasoconstriction in nasal mucosa, which primarily expresses alpha receptors. The imidazoline compounds nafazoline, xylometazoline and oxymetazoline are selective alpha agonists. They may cause initial stinging sensation as in nafazoline. Regular use for long periods should be avoided because they cause mucosal ciliary function impairment. What are adverse effects? Mucosal ciliary function is impaired on long use in case of atrophic rhinitis and anosmia, which can develop due to persistent vasoconstriction. These drugs are absorbed from nose and produce systemic effects, mainly CNS depression and rise in blood pressure. Now, nasal decongestant should be cautiously used in hypertensive patients and those receiving MOA inhibitors. These are some drugs given to patients via topical and nasal routes. Xylometazoline 0.05 to 0.1% topical in nose as nasal drops. Oxymetazoline 0.025 to 0.5% topical in nose. Some common examples are Nazivion, Sinarest, etc. Now, what are the therapeutic uses of nasal decongestants? In colds, rhinitis, sinusitis, blocked nose or eustachian tube, one of the alpha agonists is used as nasal drops. Second, shrinkage of mucosa provides relief, but after congestion, when action wears off and atrophy of mucosa on prolonged use are still a problem. The imidazoline should be used in lower concentration in infants and young children because children are more sensitive to central effects of these drugs. Now, quiz time. First, which of the following is not a nasal decongestant? First, phenylephrine. Second, xylometazoline. Third, clonidine. Fourth, nafazoline. So, answer is option third, clonidine, because rest all are nasal decongestants and clonidine is an hypertensive drug. Next question. Which of the following drug can be used topically in eye for producing mydriasis when cyclopegia is not required? Option first, methoxamine. Second, phenylephrine. Third, pseudoephedrine. Fourth, nafazoline. So correct option is second, phenylephrine. Next question is, which of the following is not an indication of nasal decongestants? Option first, rhinitis. Second, sinusitis. Third, pneumonia. Fourth, common cold. As we already studied earlier, rhinitis, sinusitis and common cold are major therapeutic uses of nasal decongestants. So option third, pneumonia, is correct answer. Then, which of the following drugs may cause initial stinging sensation on application? Option first, phenylephrine. Second, nafazoline. Third, xylometazoline. Fourth, pseudoephedrine. So correct answer is option second, nafazoline. Identify the false statement regarding nasal decongestants. They are alpha agonists. Second, on longer use, person can develop atrophic rhinitis and anosmia. Third, they produce systemic effect like CNS depression and fall in blood pressure. Fourth, imidazoline should be used in high concentration in infants and children. So, false statement is option number 4, imidazolines should be used in high concentration. But the correct answer should be imidazoline should be used in lower concentration in infants and children. Thank you.